Hi everyone, welcome back to my channel. This is Dr. Shilpi here, and in this class we'll be talking about dental considerations in COVID-19 patient. The first thing that we need to know is that we need to assess whether the patient actually needs the treatment. So that is the assessment of the need of the treatment. So the patient can either fall into an emergency care. So emergency care, the patients who come under this category are the ones who've had an accident which presents with difficulty in breathing, or when there's cellulitis, which is so much that there is difficulty in breathing, or when there is uncontrolled bleeding. Such patients need to be attended as soon as possible, so they fall under emergency care. Then the second category is urgent care. So which all patients fall under urgent care? Whenever there's class 3 Achilles fracture, whenever there's avulsion, or whenever there is pain due to abscess or due to pulpitis, when there is severe pain. So such kind of patients can be managed by medication, but if it doesn't resolve by medication, this can go under and fall in the category of emergency care. They might need emergency care in the later situations if it's not resolved. Then the third one is scheduled care. So the patients who come under this category are the ones for whom, if the restoration is removed, such patients where the treatment can wait for some time, suppose a root canal filling has come out, or when there is at least class 1 or class 2 fracture. So such patients come under scheduled care. Then the second step is, once we decide that which patient need to undergo an emergency care, after that the second thing is the risk assessment. Now we need to call the patient and we need to assess the risk of the patient based on the geographical location, that is whether there is community spread in the area in which the patient is living. Then any kind of temperature, any kind of respiratory symptoms if they are present, or if there is any kind of exposure of the patient to anybody who's had COVID-19, or who has been in touch with somebody who has had COVID-19, or has a travel history in the area where it is quite spread, or lives in the area in which, or himself has a travel history, or lives in an area which has a community spread of the disease. After we are sure and we rule out everything, then we decide to call the patient for treatment, and that therefore the third step is the dental treatment. So coming to the dental treatment, once the patient arrives in the clinic, before that, over the phone, when we are taking the history, we need to tell the patient that patient should not get nobody should accompany. The escorts should be discouraged, that is, no family member should accompany the patient, and we should also avoid overlapping appointments, and also make sure that before the appointment in the clinic, in the reception area, we need to remove all the unnecessary things which can serve as a mode of infection in the area. And also social distancing. The chairs need to be placed at a distance of 1 to 2 meters. Then the next thing is arrival of the patient. When the treatment, the third step in which we're doing when we are treating the patient, as soon as the patient arrives, we need to give them an alcohol-based scrub to use it on their hands. Then we need to take a COVID-19 questionnaire. A proper thorough medical history needs to be taken, and it is also advised as per the guidelines that we need to provide at least a surgical mask to the patient. After taking a thorough history and everything, then a COVID-19 specific consent form needs to be signed by the patient. Then we take the patient inside. That time hand hygiene needs to be followed by the doctor thoroughly, and all the personal protective equipment need to be worn properly. And after that, the procedures that we need to avoid are the ones in which there is lot of aerosol production. So anything like cleaning, ultrasonic scaler tip, or use of sonic scalers or air rotor needs to be avoided. Then we need to minimize the use of taking x-rays, because sometimes when we are taking intraoral x-rays, there are chances that we induce gag in the patient, which can in turn lead to coughing and sneezing of the patient sometimes. So we need to avoid taking an intraoral radiograph as much as possible. Then we need to also minimize the use of three-way syringe that we use, because it can also result in aerosol production. Then another thing that we need to follow is that we need to try to use rubber dam as much as possible in the procedures. If not, in such cases, pre-procedural mouth rinse can be given. That is povidone iodine or hydrogen peroxide mouth rinse can be given, because it reduces the microbial load in the oral cavity. So we should try to chlorhexidine. Mouth rinses are not found to be active against coronaviruses or COVID-19 virus. So that needs to be avoided. That will not be helpful. Then if any procedure that involves the administration of local anesthesia, in such cases, prior to the appointment, we should tell the patient to take NSAIDs and come, so that the procedure is smooth. Then any kind of excavation is required. In that case, spoon excavators can be used, or we can use a micromotor at a very slow speed, and we should avoid the use of water spray. Then four-handed technique should be used with the assistants helping during the procedure. Then if extraction has to be planned, then suture needs to be given after the extraction, and all the gloves and everything need to be discarded properly. Sutures need to be given, so that in the we minimize the risk of dry socket or something. So once we finish the procedure, any dental procedure that's been planned, once we finish the treatment, after that we need to disinfect the treatment area properly, and we need to disinfect the reception area properly, and we need to clean the instruments, we need to wash the instruments, pre-treat them and sterilize them properly. Any instruments that can be discarded, we should try to use as much as one-time use instruments which can be discarded at once. They need to be discarded. And after that, one more very important thing is that we need to follow up the patient for 14 days for any kind of respiratory symptoms, because just in case if the patient develops any kind of respiratory symptoms, then we need to, even the healthcare workers who are there in the clinic are at risk. So a follow-up needs to be done for at least 14 days over the phone. And in the next class, I will be covering the disinfection and everything in detail. So that brings us to the end of the class. So if you want any other topics to be covered, you can leave a message in the comment section below. And thank you so much for watching. Thank you.